And welcome back. We're moving into our final discussion for today, and we've been joined by, from the National Epidemiology Unit, the Dr. Russell Manzanero, who's the epidemiologist. Good morning.
And welcome
to the show.
Good morning. Thanks for having me again.
Now, besides being a tongue twister, let's talk a little bit about what the National Epidemiology Unit does.
Okay. Well, we're actually a unit well, many understand that when we talk about epidemiology unit, we talk about statistics. We talk about numbers and reports and data that we manage and we actually release for publications and use in the country or internationally. However, the unit also does a lot of what we do with surveillance. So with this ongoing with arboviruses, dengue, chikungunya, Zika, that is only a part of what our surveillance does. Yeah. We actually assist the regional surveillance committees throughout the country. So we actually give them support from our end. We always get back reports from them so we can actually follow and see where that is needed. The way how they do it is that they send us on a weekly basis their reports, their graphs, so we can actually see throughout the weeks any changes. And with those changes, then us at national level can actually follow up with them and see where exactly that aid is needed. Yeah. So for now, our focus, what we're looking at right now are arboviruses. So there's a lot of work going on there. It's a topic that we've been discussing here as well. So that is something that our surveillance units are doing.
Now, before we get into some of that information, I wanted to talk about the unit itself and how resourced it is. The epidemiology unit has been a little bit deficient for a very long time. Oftentimes having one person or two persons in the unit. I understand in your last appearance that you made that you were actually seconded from the Belize Defense Force, was it?
Okay.
To be able to...
She did her research.
I know.
No, he said that on air the last time he was here. And I found it interesting because it is an important part of healthcare in a country. You can only tackle what you know is a problem. And you can only know the problem if you have a good epidemiology unit. So let's talk about the resources and in terms of being able to manage all the information that comes in.
Yeah, well, I see you've done some research too. Yes, the unit has been for the past very limited. So human resources was a problem there. I am, well, seconded from the Belize Defense Force, so fortunately I can offer services nationally as well. Yeah. So there is much that the BDF has done from me on that side to actually get all this on board. Yeah. What I have seen, though, is that right now the unit is actually growing. Yes. So the posts that we have are being filled. So we now have our biostatisticians, we have 2 epidemiologists. So the unit is growing, so there is capacity to actually engage in more activities that can be done from our end. Yeah. So definitely it was something very deficient before. The unit was very small. There was 1 or 2 individuals doing all the work. There is so much more that the unit can offer. So there is, now that there are individuals that are there, we can do so much more, and you're going to see it. Yeah. We're going to have more things published on the website itself, and we're going to release some more data.
What would you say is the biggest challenge that the unit faces? Is it resources or actually working with the general public in terms of trying to collect the statistics that are necessary?
I think it's both. There is an issue of resources still. There is a need to actually get more that we can do in the unit. At the ministry level, there is so much more that we can actually work with. We've been engaging with other NGOs. We've been engaging with international organizations who actually are looking at funds that we can use nationally to actually strengthen our lab capacities, our surveillance units as well. So there is that ongoing collaboration with them. Yeah. When we try to get back data, it is something that we actually notice is deficient from the regions. Yeah. We get data that is from the public and private sector, but there is always that shortfall from the private sector. So we try to get back that we try to get it in, but it's still a challenge.
And this is important because you do get information from the Belize Health Information System, which is inputted across the country, right? But the private institutions don't have to report everything that comes into the epidemiology unit, right?
That's right. We can say that around 80% of our public facilities have the healthcare information system.
Okay.
The private sector doesn't. But the way how we do it is that all reportable and notifiable diseases need to get submitted on every end to our statistical clerks in the region. So what they do is that they go out and they send out this information, they capture it, and they still input it to our end. So even though they don't have the system, the electronic system, it is still being captured.
And there's certain diseases that they have to report.
Yes.
Yeah. Like?
All notifiable diseases, for example, arboviruses is one. So we're stressing on that with Zika. So every individual who is seeking this surveillance is actually something that we need to look at. So they need to notify this. We're focusing on pregnant mothers, so that's the reason why we need to do that.
So any Zika, dengue, chikungunya, HIVs, those have to be reported from the private sector
to us.
Okay.
As a unit, when you're talking about collecting statistics, what's one of the areas that we still have a deficit, a significant deficit, and one of the areas that is most important for the unit in terms of planning?
You're asking, sorry,
in terms of collecting statistics and obviously the statistics are used to better plan on the services that the health sector delivers, sorry. So what area would you say is still one of the more difficult areas to collect statistics so that the planning can be improved? Because you're talking just now.
Yeah. Okay. Well, what we're seeing at the unit is that we're actually getting, right within the unit itself, when we're looking at the BHIS, for example, we're getting individuals who are actually seeking care more than, for example, if you go today, you might already have your encounter open, but for some reason you go back, another encounter is open, so you're getting duplicates.
Okay.
So there's an issue of our duplicates in the system that we might be counting more than one episode of something. So what the unit is doing is that we're developing tools that you can run queries and actually seeing that if those duplicates are actually phased out and we're getting the right numbers. So data validation is something that we're working on. It's something that needs to get done on a regular basis. It takes a lot of time, a lot of work, even though the tools are quite automated. So it's something that we from nationally actually go out regionally to actually install those tools so that statistical clerks can actually use them and make sure that it makes that data capturing easier. So with that, we can actually validate and verify our data.
Now, having concrete data about the health profile of a nation is absolutely important. And typically what we see is some of the information regarding common illnesses that people suffer from, common causes of death. I want you to talk about what the health profile is of Belize, because that's really where we get that information from the epidemiology unit, and perhaps we don't talk about it enough. We don't talk about the diseases that are affecting Belizeans. We don't talk about what's killing people the most. So I want you to paint the picture as to the epidemiology or the health profile of Belize.
Okay, when you're looking at statistics and you're looking at when you're dealing with mortality or morbidity of diseases, it's pretty much what you're seeing globally. So we're not that different from other regions. You're going to know the leading causes of that now is what we call in a transition, that we're moving along from what is infectious now to communicable. We're looking at obesity, we're looking at cardiovascular diseases, we're looking at hypertension, diabetes. So those are the leading causes now. So
complications of some of the common things we talk about: diabetes, hypertension, obesity, heart diseases.
Cardiovascular.
Those are becoming our main cause of death in this country.
That's right.
Okay. And other areas, I know road traffic accidents or accidental and...
Yes, those would rank in the third place, So we're seeing more of those cases as well. So
what are the top three causes? Sorry?
Cardiovascular, we're seeing infectious, and road traffic. So other injuries.
So infectious would be?
Anything that we have, for example, with the arboviruses, even though we don't have high mortality rates, we have an increase with dengue. There is still the severity of dengue and malaria. So even though we don't have high numbers, those are what we're looking at. So.
Okay.
Now,
so that's, sorry.
When Marlene was talking just now about the profile, do you also break it down based on districts and gender?
Yes, we do. We have them regionally. So regionally, we have them by districts. We actually can go as far as by community. For example, when we look at dengue, we can actually know hotspots.
Yeah.
So when we look at that, we can actually narrow down and see where we can actually target. That is where our interventions and surveillance can actually focus on. What we're looking at is that we want to actually get on board into GIS and mapping so that we can actually see and have graphically where we can actually do more interventions.
I know that was one of the things you spoke about in terms of your mosquito intervention programs. The information that is already available already identifies where people are most at risk, and a lot of the interventions have been focused in that area. Is that how it works?
Yes, it is. That's the way how we do it. There's a component that we do with our surveillance committees. They actually engage in active surveillance, so they will actually go out in the communities and look for those cases. Yeah. So many of the cases that were being seen of recent, for example, for Zika, when we were looking at Zika and we were looking for new cases, those were actually cases that actually went out, they looked for them, they caught them on time, sent out the samples, and those samples did come back. So those are what we were seeing in mostly in Cocker. So those are what we were seeing, and that is something that is happening in the entire country. So, yes.
And as we talk about gender, can we look at what are the major causes? Is it the same for both men and women?
It depends on what you're looking at. There are some, yes. So if you want to talk about diabetes, hypertension, you're going to notice that it's higher in the male population. So definitely there are some aspects that you're going to see that the gender is higher, of course, in males. Yeah. So there is, but that's something that we're seeing is not only here, but it's something that is
across the world.
Yeah,
and is it because there's still a reluctance for most males to access the health service system?
In a way,
until it's in a critical.
In a way, it can be. It can be related to that, but it's more. I believe it's genetically that men are more predisposed to certain illnesses. So, and of course, women can actually access healthcare, like you're saying earlier. So it's something that they can detect from very early, and they can manage it.
And age groups is also taken into consideration.
Yes.
So we know what might be the overall top cause of death might be very specific for particular age groups. Usually it's the younger demographic that the leading cause of death is the major accident. And
when you're talking about causes of death related to accidents, injuries, or yes, you're going to look at the younger population. If you're talking about communicable, or if you're talking about diabetes or hypertension, it's the older population. So we actually get our data. We can disaggregate by age, sex, age group. So we can tell where that is. So it's like I mentioned, it's not much different globally. So we're seeing those pretty much across the globe.
There's some very interesting information that comes out of the epidemiology unit, and I think that's perhaps, we don't take advantage of getting the information, but we do recall when there was the report that came out talking about obesity, and the problem was shown to affect mostly women of a specific age, but it was across the country. What are some of the other interesting statistics about Belizeans and their health?
Interesting data? Yeah. Well, we're now trying to work on cancers. Yeah. So I believe it's a topic that you've been discussing about cancer, something that is ongoing. We at the unit don't have data readily available on cancer, so it's something that we want to look at and address. Okay. We want to see exactly who are the target population, who are the individuals who are being faced with it, and what type of cancers are in Belize. Yeah. So that is data there that for us is pretty. We want to embark on it and see what we can do with it. But you're mentioning, for example, obesity. That is something. It's an ongoing topic at the ministry. We've been engaging with talks with Robin Daly, who's a nutritionist as well. So if you're talking about other diseases that are peculiar or particular, I think there isn't any one specific, unless we're looking for that one. But it's when we get our data, we get everything, so we can see exactly what it is.
Yeah.
We continue seeing increased numbers of HIV, STI, so those are the things that we actually focus on.
Yeah.
I wanted to ask one specific thing, because we've been talking about NCDs, for example, and tracking those. But looking at ethnicities and how that, what pockets of or ethnic groupings actually you see more particular diseases showing up. And I know a big part of it has to do with cultural foods that they traditionally eat as well, or movements, or what are, in terms of ethnicities, do you also look at that as a part of it? And I know for some people it might be a little bit too specific, but
yeah, when we look at our data, it is something that definitely we would like to have data disaggregated by ethnic groups as well, which would be, I mean, would be wonderful to know exactly which groups are being affected in the country. We don't have that data to actually safely say, okay, this is a particular group that is being affected. But it's something that we can do. We can do further analysis. So now that we have the capacity to do it, that is something that we're going to embark on.
Yeah.
We do know that culturally, because of the foods, genetically, of the genetic makeup of the individual, certain individuals are predisposed. Asian, Caucasian, or it depends. So there is a predisposition of having certain illnesses related to your ethnicity. So that is something that we would like to actually embark on.
Is a challenge there because it's more a self-identification in terms of your ethnicity?
It's in part of that, yes, but it's part of how our system or health information system is capturing that data as well.
Yeah. Now, ideally, you could have researchers do cross-reference with the census, for example, and be able to identify if it's Spanish Lookout, for example. You know, that's primarily a Mennonite group. Now, I touched on the topic of research because I know that that's one of the areas in the country that we're very hungry for valid information. A lot of the things we know anecdotally. We come more in contact with persons who have diabetes, so we know a lot of diabetes is out there. We come more in contact with persons with cancer, so we feel, oh, there's more cancer in the country. But in terms of valid research coming out from Belize, that is a part of the role of the epidemiology unit. So, explain that to us, and what kind of research is ongoing, who can be able to access your stats to be able to provide a picture as to healthcare in the country?
When you're talking about research, it's basically anyone can come in, do research in the country, but before that happens, they need to actually get a validation and approval from from the Ministry of Health.
Yeah.
So what we do is that proposal that gets submitted for whatever research they want to do in country, then they need to pass it through the unit to actually make sure that it gets vetted, that it meets standards, ethical approval, that the research being done in the country meets all ethical approvals internationally. So we look at that, we make sure that the individuals being captured or the population that is being studied are within ethical limits. So research can be done for anything in the country as long as there is data that they can actually get validated data to work with. So that is where they actually need to work with us, the epidemiology unit, because that data needs to get verified and validated that it's true data. We don't want anyone coming in and just getting data on the outside and then taking it back and then it's published internationally and then it says, well, how come this was released from Belize? And then that is where we want to work at. There is so many, right now we have research being done for diabetes, hypertension, Zika preparedness. So there is so much ongoing research at this moment that is still being looked at. And we actually need to make sure that it's meeting standards as well. So that's very important for us.
And in terms of the future for the unit, What would
priorities.
what would you like to see in terms of priorities and in order for it to fulfill its stated role in terms of being a critical part of the health sector?
I believe for us, for example, right now we're working along with a lot of surveillance issues. We want to look at influenza, we're looking at arboviruses, not only Zika, we want to focus on the actual dengue, Zika, chikungunya, everything in one. So we're looking at that, we're looking at other surveillances that we want to embark on. So for us as a unit, what we want to do is to strengthen all of that. We know that there are gaps within the system. We recognize that there is so much more that we can do when it comes to lab, because even though the lab is very important to work along with us, there is that component of lab surveillance that falls underneath what we know as epidemiological surveillance as well. So that component of integration and collaboration within sectors is very important. There are many times that when we want to address certain issues, you're going to hear from the community. They said, what is the Ministry of Health doing? What is the Ministry of Health doing? So there are many times that it's not only the Ministry of Health's responsibility, but we need to get other sectors involved. So for us as a unit, we need to start engaging and activating all of that. So from our end, that is what we want to look at. We want to have more publications. We want to get our websites for the EP unit on board. So we're looking at that. We want to get more research done in the country. So, you know, with research, there is so much information that can come from a country that you can actually get recognized and know where we need to work at. So research is very important, and we are on board with everything that is research. So of course within standards we need to know that that is happening well.
Okay, great. So is there anything else you'd like people to know about the epidemiology unit?
We are focusing on statistics, yes. That's our main thing, that we work with statistics, we release our data, we deal with data management and validation. That is true, so that we can actually use it to actually make decision making. But we actually want the public to know that as a unit, we're actually supporting the surveillance committees regionally and throughout the country. So there is a lot of work out there that we need to actually start focusing on. So it's not only data management and statistics, but there's a lot that the unit does in regards to research, surveillance, and assisting them. And
so when a healthcare provider asks you for your information, it's important for the unit as well that they're providing valid information.
Yes, that's true.
All right. Well, Dr. Montanero, we want to thank you for joining us and sharing with us some of the work that's taking place behind the scenes. And also, hopefully we can look out for some more information coming out from this particular unit.
Great. Thank you.
All right. We're going to go ahead now and take our final break. When we come back, we'll have our wrap-up, so stay tuned.